My name is Channing Endress, and I'm a family nurse practitioner. I chose to be a nurse practitioner because I always loved helping others and science growing up, and just really, I feel like the Lord gave me the ability to take care of others, so that's what I want to do with being a nurse practitioner. I chose Prisma Health because that's where I started my career as a registered nurse coming right out of college. And then when I went back to school, they were gracious enough to help me with the tuition. So I thought, hey, they've invested in me. Now it's turn to invest in my patients with their help. My philosophy of care is to treat all my patients like I would my family. So that means loving on them and helping them be a healthier version of themselves. When I'm not at work, I have a family at home. So of course that keeps me busy, but we love doing anything outside, whether it be tubing down the river. Sometimes we go hiking, but pretty much anything outdoors is where you can find me and my family. If you'd like to make an appointment with me, feel free to look at the page, and that's where you can find our number, and we have lots of friendly staff waiting to hear your call.
My name is Meenu Jindal, internal medicine. I chose internal medicine because it provides me opportunity to take care of the patient as a whole. It gives me opportunity to think about some chronic diseases, prevent those chronic diseases, and help patients manage them throughout their journey with those chronic diseases. I chose Prisma Health because it gives me opportunity to take care of a diverse group of patients. I also enjoy teaching in Prisma Health. I am part of faculty at the medical school, and as part of Prisma Health, I work at internal medicine clinic with our residents. Prisma Health gives me opportunity to provide care to a wide variety of patients while providing my teaching opportunities as well. My philosophy of care is holistic. Which means, in my mind, providing care to a patient in all the ways that we can help our patient, not just by medications, but also by helping with identifying various social determinants of health, how we can address those for our patients. It also includes providing them a medical home as part of internal medicine clinic at Prisma Health. I also believe that my philosophy of care also involves providing them opportunities for lifestyle interventions, which is nutrition and exercise. When I'm not at work, I enjoy cooking, I enjoy reading, travel when I have time, but not very often, honestly, and exercise.
My name is Kelly Jeans, and I'm a certified physician assistant working in inpatient and outpatient psychiatry. I chose to be a PA because of the collaborative environment that it offered between my supervising physician and I. I chose Prisma Health because since I interviewed, everyone has been welcoming with open arms, and that's the kind of work environment that I was searching for. My philosophy of care is to treat every patient like they're my family member, and not just to treat them for their symptoms, but to treat them as a whole. When I'm not at work, you can usually find me hanging out with my friends and family or my dog. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.
My name is Elizabeth Peters. I go by Beth. My specialty is I'm a nurse practitioner, specifically an adult gerontology acute care nurse practitioner, and I'm going to be working for Carolina Cardiology. It's always been a lifelong goal for me to get to the top of my profession, and I've been a nurse for quite a long time, and after my children got old enough to get into school, I went back to school to become a nurse practitioner. I chose Prisma Health because I actually used to work as a Prisma Health nurse in their CVICU, and it just made the most sense to come back to Prisma. My philosophy of care is taking the very best care of my patients. Education is so very important. I spend a lot of time educating my patients and letting them know all they can about the heart and what the implications are of their diagnosis so that I can better work together collaboratively to get the best outcomes. When I'm not at work, I'm spending time with my family. I have 2 children, a husband, a dog. We spend a lot of time outdoors, camping, going on trips, things like that. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.
I'm Dr. Manisha Patel. I'm Medical Director of the Adult Congenital Heart Disease Clinic. I was in my internal medicine and pediatrics residency up in Philadelphia, And while I was there, I was really taken by the problems that my patients, especially young adults that were born with chronic illnesses, face as they transition from pediatric to adult care. In particular, I met one patient up there that I was involved in an ambulance transport of. And I was on this transport for an hour. And I got to talk to this young man. He was 22 years old. He had had 3 cardiac surgeries before he was even in kindergarten. And spending that hour talking to him changed my life. I knew immediately that I wanted to pursue the training that would allow me to serve him. And so that's why I chose this subspecialty. So when I was in training at Emory, I wrote a paper about looking at what access to care looked like in the United States for adults with congenital heart disease. And I was incredibly disheartened to find there was a 3-hour window around my hometown of Spartanburg, South Carolina, that had no access to care. So I came back here with the hope of starting this clinic 8 years ago. And it is really a remarkable health system to be a part of. I mean, I've trained at big institutions at Duke and CHOP and Emory, but the collaboration and camaraderie here I haven't seen anywhere else. Another big strength is sort of that vision towards the future. So the need for taking care of this patients was noted. When I came here, I was incredibly surprised and happy with how receptive the leadership was for creating the space for this clinic and serving this vulnerable patient population. Honestly, when I first came, I met a group of 35 adult cardiologists, and I haven't met a group like that anywhere in the country. There are no egos. It's all about patient care. There's a courage to be imperfect, and so people share ideas, and I think that really helps a patient succeed. My philosophy of care is anytime a patient enters into my clinic door, they become a part of my family, and that's how we run it. So I treat them as a whole. I don't treat them just as a patient that had heart surgery when they were a kid. I treat them as part of the family unit that they're part of, because part of what's unique to my patient population is that I still have 50 and 60-year-olds that come in with their moms and dads that have big files of when their kids had their surgeries when they were younger. So there's a big picture to that, and I like addressing it. There are times patients come to me with heart fluttering, and oftentimes with digging, I can find out it's not just about the heart. Sometimes it's about stressors that are happening at work. So I really do think there's a level of mindfulness that needs to occur during patient and doctor interactions, and that we're a team. So we have to be on the same page. There has to be good communication. Any steps we take forward together. When I'm not at work, I do some medical mission trips. I speak Spanish fluently, so I love being able to use that. So I've been to Guatemala, to Dominican Republic, Cuba, and several other places. So I'd love to keep that going each year. I'm usually on the soccer fields with 2 little boys who think they're like Neymar and Messi. So that's always fun to see. I love hiking, and I love this area because of that, because there's so many accessible hikes within a 45-minute drive. And then starting in August of each year, I do an annual Halloween book drive. So last year we gave away 4,000 books from my front porch of my home. So that does take up most of my time during the fall, but it's a labor of love, and I love doing it. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.
My name is Bill Childers. My specialty is family medicine, and I also have a CAQ in geriatrics. I chose family medicine because in medical school, as I went through the different rotations, I liked them all, and I couldn't narrow it down, and I decided that family medicine had the most breadth and the most variety, so I chose that field. Well, as you know, Prisma Health came from Greenville Health System. I started a practice in Lawrence because I had a rural health commitment, and our practice there affiliated with GHS, and GHS eventually became Prisma, and I like Prisma because of the safety net nature of it. We take care of patients no matter what their insurance coverage is. I also enjoy the academic experience, having medical students rotate through our office, and feeling like I'm part of a big system that no matter what comes down the pike in healthcare, that we are prepared to handle it. My philosophy of care is to try to focus on that patient, one patient at a time, not be rushed, to listen to them first and find out what their priorities are for the visit, and then from that point on, let them lead the discussion and try to be patient-centered. When I'm not at work, I have been a runner. I've done a couple of marathons and many half marathons. As I get older, it's more of a walk-run. I enjoy going to the gym. I spend a lot of time with my family. I also am an avid supporter of the Clemson Tigers. If you'd like to make an appointment with me, please call the number on the webpage.
My name is Scott Porter. I am an orthopedic surgeon that practices orthopedic oncology. Interestingly, when I was young, I found myself wanting to be an architect. My father is a blue-collar construction guy, and it seemed that orthopedic surgery allowed me to marry a whole bunch of interests into one and to speak a language that my father and my family could understand. Prisma Health was an interesting choice. At first, it was a choice because my wife is from this area most recently. What I have come to really enjoy about Prisma Health, which keeps me here and will keep me here, are two things. One, it's a teaching hospital, and I absolutely love the ability to teach and interact with upcoming professionals, with all of the ancillary staff that we have here. It's a massive family, it's a massive team. The second thing is the surgical subspecialties and the surgeons that we have here at Prisma are second to none in the entire country. The colleagues that we have here are as good as any set of surgeons anywhere that I have found in any of my travels from Yale to Mississippi. My philosophy of care is pretty simple. There are no right or wrong answers, there are just answers. And once you select one, there are risks and benefits, and we try to maximize the benefits and mitigate the risks. And at that point, we are all in with whatever plan that we pick. And that's a philosophy that has guided me pretty well for quite some time in the field of cancer. When I'm not at work, I am generally hanging out with my family, and if I have a little bit of free time to myself, I thoroughly enjoy golfing in the summer and hunting in the winter.
My name is Lisa DuBose, and I work in the Children's Hospital in the Department of Pediatric Pulmonology. I chose to become a nurse practitioner because when I was practicing as an RN, I was learning so much, but I wanted to do so much more to be able to help the patients and the families that I saw. So then I pursued my master's degree and finished up that coursework and the credentialing, and I've been practicing as a nurse practitioner for quite some time now, and I really, really enjoy it. I chose to work for Prisma Health because of my own personal experience with having 2 of my 4 children be in the neonatal intensive care, and the pulmonology team and the cardiology team and all the neonatologists saved my 2 children. So when an opportunity came to work with Prisma Health, I was more than excited to be able to join the team. My philosophy of care is much more of a family approach, meaning that it is not a dictatorship. We need to work together with the patient and with the family as a team so we can come out with the best outcomes for the child. When I'm not at work, I live in the Clemson Central area, so I do have quite a commute, but I live there with my husband and my 4 children, and we are very involved in my church and lots of outdoor activities, and of course walking with my dog.